knocked out your teeth? What to do now? Knocking out a tooth or dental avulsion is one of the most common trauma-related dental emergencies. Acting quickly has a direct impact on whether the tooth will be saved or not. If it is a primary tooth or baby tooth, the avulsed tooth is never replanted. Management of injured primary teeth differs from management of permanent teeth. Avulsed primary teeth should never be replanted to avoid damage to the permanent dental crypt and to avoid ankylosis or fusion of the bone to the primary tooth root. If it is a permanent adult tooth, it is critical to do the following. 1. Find the missing tooth and assess whether it is the full tooth with the root intact or if it is only a piece of the tooth. If there are jagged edges, then likely it is fractured. Teeth with fractured roots are usually not savable. Number 2. If the tooth is whole and has an unfractured root, gently rinse in saline, milk, or water only to remove debris. Do not scrub it or rub it, as it will damage the periodontal fibers and cells which are still alive. Number 3. Attempt to reimplant the tooth in the correct orientation back into the socket and proceed to a dentist office immediately. Number 4. If it is too painful or not possible to reimplant yourself, put the tooth in milk or an isotonic saline solution, or keep the tooth in your mouth, under your tongue, or inside of your cheek. Do not store the tooth in tap water, as this will kill the PDL cells. Get to a dentist immediately. Number 5. The tooth should be reimplanted in less than 60 minutes, or else the prognosis for the long-term survival of the tooth is poor. Once at the dental office, the dentist will inject the site with local anesthesia for your comfort. He or she will ensure the tooth is positioned correctly and then use orthodontic wire or other splinting material to splint the tooth to the adjacent teeth. This will stabilize the avulsed tooth and allow for healing. Within approximately 2 weeks, the splint should be removed, unless there was also injury to the bone, in which case the splint will remain for up to 4 weeks. Within 7 to 10 days after the replantation, the pulp tissue will be removed and a root canal will be completed. If you or anyone you know has had dental trauma or avulsed teeth, please call your local dentist. If you are in Edmonton and surrounding area, feel free to call Smiles Dental Group or visit us online at smilesdentalgroup.com.